107.3 KFFM, Middays with Sarah J. I'm here with Comprehensive Healthcare. We do Mental Health Mondays, and so every month we're focusing on different aspects of comprehensive healthcare, and this one is about Aspen Victim Advocacy, and I've got the program manager, Debbie. How are you doing today?
I'm good. Thanks for having me.
Thank you for coming in. I know that this is a heavy topic, but also a very important one for not only the Yakima County, but all over the place. So you deal with the Community Sexual Assault Program.
Correct.
And what exactly is that?
A community sexual assault program provides services to victims of sexual violence. It can be women, men, children. It could be those that have been recently victimized, or perhaps they were victimized as children. They're adults now and they're just seeking help for the first time. Really, anyone who has experienced sexual violence, we're there to help them. And sadly, I would say at least 60% of the individuals that we serve every year are under the age of 18.
Oh, man.
Yeah.
How do they find you?
Well, that's something we really are working on, and that's through community education and making sure that all of our community partner agencies are aware of our services and can make referrals, making sure that we get our flyers, our brochures out to many places. And then also we go out and do outreach and community education whenever possible. And if somebody asks us to come talk, we'll come talk to them and provide them with that information so that we can make sure that the individuals who need our help are going to know where they can get it. The more people in the community who know about us, then the more they can provide that information when they see abuse possibly happening around them.
Do people need a referral before they reach out to you?
No. I would say most of the people that we help do come through a referral from law enforcement, the hospital, prosecutors, or maybe other social service organizations make referrals. We have a 24-hour hotline so that anyone who is in need of our services can speak with a trained advocate 24 hours a day, 7 days a week. And so we get a lot of calls, and that's their first contact with anybody asking for help.
What's that number?
Our hotline number to always reach an advocate is 509-452-9675.
And is that in the Yakima County or Washington State?
That is for Yakima County.
Okay. Is there another number for the Tri-Cities area?
There would be another number for the Tri-Cities areas because there's an amazing program, actually. It's called SARC, and it's Sexual Assault, I think it's a Resource Center. SARC, and they're there in the Tri-Cities. They've been providing for years.
Okay, and I'll put that information over at our website. Once somebody has contacted you over the phone, the 24-hour line that you're talking about, what kinds of services are you providing or information are you hoping to gather?
So we practice what is called survivor-centered or survivor-driven advocacy, which means that we take our cues from the individual that's reaching out to us. And so we're about listening to what they have to say, maybe asking questions and finding out exactly what it is, what kind of help they're looking for, and letting that prioritize what kind of help we provide. So sometimes callers just want somebody to talk to. They don't want to go beyond that hotline call where they have a listening and supportive person to talk to, but often they are wanting some more hands-on advocacy. Maybe they were just recently assaulted. They have to do interviews with law enforcement. They may not have gone to the hospital yet for a sexual assault exam, which I want to say this is an important thing. Anybody who's been sexually assaulted, please go to the hospital and have a sexual assault exam. You do not have to make a police report in order to get a free forensic exam. It won't go any further than that exam if you are an adult, unless you want it to. But you can be checked to make sure that that you weren't exposed to any sexually transmitted infections, or to test for pregnancy, provide prophylactic medications, things like that, and to look at injuries if there are any. So that is something that I just really want the community to know, because a lot of times people think if they go to the hospital, they're going to call the police. And that's not necessarily true. Obviously, if you're a child under the age of 18, we're mandated reporters. Medical professionals are mandated reporters. And so law enforcement's going to be called in those situations.
And just a side note for everybody who's listening out there, if you have been assaulted or you've been in a situation, this is not your fault.
Absolutely not. It is never your fault. And that is something that I think holds people back from reporting or reaching out for help, is that they do focus the blame on themselves because they listen to all those messages that we have in society about, well, what were you doing at that bar? How much did you drink? Or what were you wearing? Or all those kind of just myths that have nothing to do with why somebody would sexually assault you.
Mm-hmm. That's on them. They
absolutely.
need help. So by not saying something or being aware of something and not saying something, we're not helping the people that really need need this stuff. So I'm so happy that you are here and you're open and you're ready to help. And you were saying 60% are under 18.
Yes. It's not the stranger that's preying. That happens sometimes, but it is not the stranger. It is almost always somebody who is well known to the victim. It's usually a family member, maybe a very close family member, a parent, a step-parent, but also uncles, aunts, cousins. It's people who have the access to children, have the opportunity to victimize them. Mm-hmm. Something where silence is taught. And, it's like children are afraid to break up the family, disrupt their lives and people's lives around them. Mm-hmm. And also the perpetrators let them know that it would be their fault, and they threaten them or they threaten family members. So there's a lot of ways that silence is coerced for the victim.
And the best thing you can do is to talk about it and keep talking about it.
Find somebody that you trust, find a trusted adult that you can go and tell. Somebody at school, a coach, somebody who will listen to you and provide you support and assistance.
Right. And let's say you talk to one person and didn't go anywhere. It is a good idea to follow up and get some more information and contact somebody so that we can get the ball rolling, because it's serious stuff.
Yes, definitely. If you told somebody and they didn't do anything or they just kind of wanted to silence you further, then you know what? That wasn't the right person.
Yes.
So find somebody else, and keep talking about it till somebody listens to you, because you don't deserve to have that abuse. You don't deserve to have your childhood affected in that way. And so as we try to get out there and educate the community, then hopefully a trusted adult that you talk to will know about our program, get you connected, help your parent who is a safe and supportive parent, help them get access to resources so that this doesn't have to define your life, that it doesn't have to have that impact, because oftentimes people don't ever get help, and they sometimes are reaching out to us when they're now adults. At the time, they think, I'm fine, I don't need any help, no problem, but it has a way of resurfacing, especially under times of stress, and can manifest in having some mental health issues, because it has an impact on you whether you realize it or not.
Yeah, it changes your outlook on everything. So it's uncomfortable and it's embarrassing, but again, not your fault at all. And you take your power back by saying, I'm not going to let this happen. I don't want this to happen, and people need to know. And it's good to know who doesn't want you to not say anything too, because
exactly.
There's a lot of that business out there. So thank you again, Debbie, for being the program manager. Aspen Victim Advocacy. This is the Community Sexual Assault Program. April is Sexual Assault Awareness Month.
Yes. And every year during the month of April, this is the 21st year, there is a theme to our efforts. And this year's theme is we can build safe online spaces together. And, we've been in a pandemic and we've been very isolated, and more than ever, people have utilized online resources, technology, screens in their daily life. And there just are so many ways that somebody who is a predator, somebody who is looking for somebody to victimize, how they can use online technology in order to commit sexual abuse. It can be online harassment, sexual harassment. It could be things like sending intimate pictures or videos without the person's consent. It can be sending pictures of themselves without any request, just sending pictures that you have no desire to have. There's so many ways. I'm not a technology expert, but I can tell you about some things we've seen just in, I'd say, the last year. We've seen incidences where pictures have been posted online in order to retaliate on somebody who had broke up with them. So they post pictures, create Facebook profiles, and pretend to be that person and put derogatory information out there. They will send online pictures directly to people that are important in that other person's life. One of the scariest was this woman who has just been victimized through all types of cyberbullying types of ways. And a profile was created in her name. He stole a picture. He had many pictures because they had been in a relationship. And then he basically had her advertising for sex. So people were showing up at her home, knocking on the door and expecting that she was going to provide sex. And this happened multiple times. And it's really challenging because I think law enforcement and prosecutors computers, a lot of people haven't totally caught up with fully understanding the use of how technology is used to commit sexual violence or to abuse people. So they oftentimes don't really research it or check into it and trace it back. They say, well, we don't have any way of proving who it was, and so it's
IP
very
addresses.
frustrating. Yes, exactly. We know there's ways. It's just that the resources aren't always committed to doing the work to track it down. So this person has been being victimized for several years.
Oh my goodness.
And so, those are some of the ways the technology, but also we were talking about kids that play video games online.
Oh yeah, and then the access to talking to other people.
Right. We've all heard also about catfishing. That's a term that most people know about. And some catfishing takes place through the use of video games too. Is that somebody's pretending to be somebody that they're not and building friendships and getting information, then exploiting that information in order to try to lure that child to meet with them. So they may think they've been talking to a 12-year-old or a 15-year-old or somebody, and they think that they've really developed this loving relationship, and then they can lure them for not good purposes, obviously. And so that's really important to know who your child is gaming with online and to just be aware of what is being accessed.
And for kids out there, too, your parents are trying to look out for you. And it's true, you don't know who's on the other side chit-chatting with you. So be open and honest about the friends that you've got on there. And if somebody does reach out and they've got some message for you and they're telling you to meet you at some park, no.
Right.
We're not doing that.
Yeah. And don't give out your personal information. If you don't know them from an in-person contact, like you go to school with them, you're connected to them in some way, so you really know who it is, don't give out your personal information to anybody because they're bold. They'll show up at your house. They'll be like, I'm outside, come out, So not to scare parents to death, but to make you aware of the many areas in which your child can be vulnerable. But it's not just children. Adults are also vulnerable to many of these same things.
You get comfortable and you put your guard down for a minute. And
the way that we can help create those safe online spaces is one, by just being aware, talking to our kids, educating ourselves, and reporting things that we see, reporting harassment that you might see, or bullying or hate speech, reporting that so it can be removed.
All of it.
Yes.
Every single time. Because you are not the only one that they're doing this to. And if we're complacent and we don't say anything, they're just going to move on to somebody else, or they're going to keep you in the rotation of all of this stuff. It is their issues that they need to work on, and you don't need to feel like you're being strong by being like, I could take it. It's okay. It's not a big deal.
Right.
All of it is a big deal.
It's just online. I can ignore it.
Yeah, don't do that.
As bystanders, it doesn't have to be the targeted person that reports it, but you as a bystander, if you see somebody that's being harassed or bullied, if you see inappropriate content, if you see what looks like pictures of a child that are inappropriate, you report it. Don't just kind of like, oh, that's awful, and move on. Let's see it and let's report it, and let's try to create respectful online spaces at all times.
What is that? Codependency and acting like it's not that big of a deal. Those are all things that we all deal with, and we all sometimes are like, oh, I want to protect. We have to stop doing those things. If somebody is doing something that is inappropriate, regardless of who they are, it has to be brought to light. We have to stop hiding all of these things because we can't get better if you don't.
Exactly. I think for people, sometimes we suspect that maybe there's abuse going on, whether it's online or otherwise. We suspect that somebody is experiencing abuse, but we're afraid to mention it. We're afraid to ask about it. And I think that fear kind of comes from not knowing all the information, not knowing how to really help. And they feel like if I ask, I'm going to have to do something. Well, this is what you can do. You can educate yourself and you can know the resources, because just asking somebody about if something's happening and if they're feeling safe in their life and providing them with a resource, that's an intervention right there. You don't have to fix it.
Okay. And you might get overwhelmed with the verbiage or how that would look. So reaching out to the Aspen Victim Advocacy and letting them know this is the situation. What are the words I would use? How do I go about this? Is something you can help with?
Yes, definitely. We get calls like that. Like, I think that my friend, this is happening, but I don't know what to do. We can help coach them with some supportive, non-judgmental things to say and give them the information of how they can best give their friend resources for help.
Oh my gosh. This is heavy stuff, but super, super important.
Everybody in this community can be an agent for change.
Yeah.
And we talked about the one way is just by asking and giving resources. Another way, if you want to be more hands-on help, is you can volunteer for Aspen Victim Advocacy Services. We are always in need of volunteers. We do a lot of community events where we can use volunteers. We have that 24-hour, 7 days a week hotline. So we train our volunteers to the same training that our staff gets, and then they help us with covering shifts with that hotline, maybe responding to the hospital with somebody. Whatever the person who wants to volunteer feels comfortable with, we can use you. And the pandemic really, really affected our volunteers. Many of our volunteers were unable to volunteer during that time period. So our resources in terms of volunteers have diminished. And so we need you.
New season, new month, post-pandemic. So Debbie, thank you so much for doing that. I definitely think I'm going to throw my hat in the ring with the volunteering. If that's something that interests you, you can head to our website for more details. What is the website that they could go to for you guys?
So they can go to the Comprehensive Healthcare website, which is comphc.org. And then you can find our victim services part of the website, which is for Aspen. And also it'll give you information about volunteering. You can call me directly. And also on our website, there is the ability to do online donations. We don't do a lot of fundraising. Most of our funding comes through government grants for the most part, but there are things that we sometimes can't cover with those, and they're all directly related to client needs.
Okay.
So being able to maybe put somebody in health for a night in an emergency situation or provide transportation or things like that. It's another way to help we would appreciate.
Debbie, thank you very, very much. Mental Health Mondays with Comprehensive Healthcare. This is Aspen Victim Advocacy Services. April is Sexual Assault Awareness Month. We've got the program manager here. So Debbie, keep doing what you're doing.
Thank you for having me and shining a light on this important subject.
Thank you for sharing.